right, everybody, we are back. One more time, Dr. Vincent, Temecula South location at Red Hawk. And you are pretty new, not new to being a physician, but new to our group.
Right.
How long have you been with us? Seeing
Been
patients?
with you guys for now about a month and a half, almost 2 months.
Okay.
So just still getting in the groove and everything like that. You know, got my name on the door and all
nice.
that.
That's how you know it's real.
Right, it's official now. Got some cards.
Perfect.
So it's going well though. It's going well.
Good. That's good to hear. What has been? I mean, really, at this point, every patient you're seeing is pretty much new to you.
Yeah.
What's kind of when a new, we'll say specifically like 65 and older, when you have a senior patient coming in for the first time,
right.
What is that? What's been like the theme, or what's kind of the more common thing going on there?
So the most common thing that I get with a new patient is just my approach to medicine. How I like to do is really line out and itemize all their medications.
Okay.
You know, top to bottom, including over-the-counter vitamins and stuff like that. To where we really know, I always want to be on the same page. You know, the goals are the goals. You know, you have blood pressure goals, cholesterol numbers, hemoglobin A1Cs for the diabetics or whatever. And I think most folks know around about that those are goals, but you know, from an execution standpoint, how do we get there? And then a lot of questions that I get for patients that have a lot of medications is how can I get rid of some of these medications?
Sure.
So I like to itemize all of those. And just really start off by saying, well, who is giving you these? Because unfortunately, sometimes patients, you know, whether it's a medication that they might have received out of the hospital, whether they might have gone to a specialist, whether they had multiple different docs within a primary care office, or whatever the case may be, you know, just getting all of those things itemized and lined out to say, okay, this is for this is for this, as far as conditions are concerned. Because then, you know, you go, if you ever do end up in that scenario with an emergency, you know, ambulance coming and stuff like that, it's like, okay, what conditions do they have? And then they should know, you know, I have hypertension, high cholesterol, diabetes, or whatever the case may be.
Sure.
But they also know for these, I'm also taking all these other things.
Right.
Or not, because not a whole lot of medications have to be permanent.
Okay.
I mean, there are certain conditions and things like that where yes, you've bought that medication for a lifetime. You know, that's you. You will always have that refilled and stuff like that. But
it's not always the case.
That's not always the case. And in most cases, I try to work with them to, hey, let's just kind of cut some of these out. Whether it's pain, whether it's antidepressants, whether it's even blood pressure medication or anything like that. You know, we try to just get to a place where it's like that's good for them, it's good for me. And really, it's very empowering for each patient because they feel like they have a lot more ownership of their health, and we can really just kind of navigate that as we go.
Right. Well, I know, like so I mean, one of the things that we like to do is the Meet the Doctor events. Obviously, you've done those, and I remember I would occasionally host those and kind of be there for them. And I remember it's kind of an opportunity for someone who's interested in becoming a patient to get to know you, ask some questions. And I remember one gentleman, he raised his hand, and this was from a physician maybe like a year ago or so. And he raised his hand, and they were like, you know, how can I help you? And he's like, I take 14 medications in the morning. He said, I only know what 3 of them do.
Right.
And he's like, I've been taking them for years. He had no idea. And then people in the back were like, preach.
Right,
like,
right. And it's like they end up with these medications. It's like, oh my gosh, you guys, you don't need this. And then sometimes it's double it. Sometimes it's, and it can be in certain aspects. It can be a little dangerous sometimes because you don't want to double things. I mean, the medications, they will do what they are supposed to do.
Yeah.
Sometimes, you know, and you just don't want to put yourself in that particular scenario. So that's one of the things that I really like to do and harp on. And if we can really get rid of a lot of stuff, I'm like, hey, we will get rid of it. I had a patient this week, and I think I got rid of like 5 or 6 meds or something like that.
That's incredible.
And she was ecstatic and very excited, and you know, we use, you know, my chart as far as the communication, which is great because patients can communicate with me. They don't always have to have an appointment, just a little quick hit of a question, and I can say, okay, just report me what your numbers are here, and I'll get back to you on what the response is, and we can go back and forth. And it's a really good way to communicate with me. And again, you know, I'm accountability and reaching a goal, which is, look, everybody would like to have very good health. I mean, I think that's somewhat, you know, apparent and locked in when folks walk in the door. You know, they want to be very good. They want to be good patients. They want to be good. They want their healthcare to be very good. So the goal is pretty much always in line. It's just about the execution part, how to get there, and having those types of conversations and that level of communication with my chart and the way we're doing it has been really, really good. So,
yeah, I think that's a really good piece of it because not a lot of people really utilize or even know what my chart is. I think that's like one of the greatest resources we can offer to patients
really
that
is.
need to be taken advantage of.
Yeah, it really is, because it's one of those, hey, I mean, even from a phone call of a medication or something that the pharmacy got mixed up, and I'm working on all the logistics with my office being new and stuff.
Right.
You know, hey, pharmacy didn't get the med. Okay, let me double check your medication or what may have you. One woman had, you know, she changed her pharmacy. So, oh, I'm so sorry, can you send it here?
Right.
Didn't have to call or anything like that, just did it through my chart. Okay, fine. Got the address, sent it to a different place, perfectly fine. So it's something I check, you know, almost like, you know, well, not almost, it's like an email every day that I check throughout the day for me. So again, that's just a level of communication that's really, you know, paramount to their healthcare and the way I like to communicate with my patients.
That's great.
Yeah.
Well, I mean, that's such a good philosophy of trying to remove medicine. And I mean, even what we did earlier today with all of our recipes, like food is medicine.
Food is medicine.
We just prescribed 3 new recipe medicines, so hopefully people can check those out. But I think that's such a great philosophy. But
it's really good. I'm enjoying it, and I'm looking forward to, again, with the recipes and everything. I'm always anxious to hear what people are making. I mean, the whole avocado sauce I got turned on to, like, you know, 3-4 weeks ago. So, you know, I'm
good. It's a popular one.
It is.
It's very good.
It is. So it's good.
All right. Well, thank you so much for hanging out one final time. And if you guys don't already know, Dr. Vincent, Red Hawk location on Temecula Parkway. Come give him a call. Come by, take a look, and you know, make some of these recipes. Talk about some of these things. Come get your medication in line.
Yeah,
I mean,
absolutely.
That's a huge piece
Monday
of
through
it.
Thursday, and be happy to have you guys.
All right. We'll see you soon. Thank you, sir.
Thank you.